Hi, my name is Brian Murphy. I'm a Shine Counselor here in Millis, and this presentation is on Medicare Part D. At the end of the presentation, we're going to actually run some simple Part D plans in Medicare.gov. So with that, let me begin. So first of all, I volunteer through HESCO in Walpole, and we have to report certain metrics up through the Governor's Office on Health and Human Services Elder Care Division. And one of the metrics that we report every fall is how much savings that we accumulate or aggregate from doing People's Part D drug plans. And each year it runs somewhere between $300,000 and $400,000. By my experience, it's a lot of people that have been on Part D drug plans for a while. They locked and loaded in whatever program they started with, but it now no longer fits their particular drug needs, and they're missing an opportunity. So, two comments. As we age, our medication needs may change. And the second part is drug plans clearly do change, and I'm going to show you what some of those cost factors are. So as part of the Part D plan, you've got monthly premiums, deductibles, coinsurance, meaning the part that you pay for. The formulary is the list of drugs that insurance company covers. The drug price is off of what drug list do they operate. And another comment that I'm going to make, because some people don't realize it, drug plans may disappear because of merger and acquisition activity. And whoever the drug company is or the insurance company is that you're on will automatically map you to another plan. Pay attention to your mail. A lot of times customers do not. So when you choose a plan, you've got to consider preferred pharmacy, the tier that the drug is in, a combination of the co-pays given the tier and the pharmacy, the premiums, the deductible, and it's a lot to juggle with. Do you have to juggle all this? No, you don't. The answer is going to be in Medicare.gov, the plan finder. It'll bring all those factors together. So to give you just a glimpse of a couple of things, I'm taking a look at an insurer, and this is at random. It's near the top of the list. You can see these SilverScript plans. These are 3 drug plans offered by Aetna. They're at different price points. As you can see, different monthly premiums. The monthly premium, if you're a low-income subsidiary, I won't speak to that at the moment. There'll be a Part D deductible, or you could buy away from a Part D deductible. And what tiers go through the deductible. Note, if I come over here, preferred pharmacies, there's a preferred and a standard pharmacy on each line. The preferred pharmacies usually give you better pricing. Virtually all the time it gives better pricing. These 3 plans by Aetna are a good example of what any insurance company does at 3 different price points in different tiers and copays. So the comment that I will make is that if you're married and you're each doing a drug plan, don't assume that you both have to be on the same drug plan. People have different medical needs, and chances are you and your spouse could be on different plans, even with different insurers. To give an example of a few of the insurers and who are their preferred pharmacies. That's another thing you want to pay attention to. As I showed you in the last slide, the co-pays are usually cheaper at the preferred pharmacy. So preferred has the lowest cost. Standard is usually a bit higher. Out of network is probably the most expensive. And for mail order, when you sign up with the insurance company, when they do give you the mailing with your insurance card, they will tell you who their preferred pharmacy is, or the preferred mail-in pharmacy. And again, any of these can change from year to year, so pay attention to your mail in the fall at the end, either during or at the end of open enrollment. The formularies, again, I'm probably not surprising anyone here. Drugs are in different tiers, and these are examples. Tier 1 tends to be the most common generics. Tier 2 might be some generics and a few brand name drugs. Tier 3 and higher are going to be higher cost, and they might only be brand names. Are all drugs covered? No. And I'm going to show an example when we get to Medicare.gov. Insurance companies have to have some drugs in every major disease state, but they don't have to cover them all. Where do you begin? Start by assembling a list of your medications, the dosage, and the frequency. Now, for something like you take one pill in the morning and it's 20 milligrams of atorvastatin, well, that's easy. But you also may have some medications where you take as needed or you only use a partial quantity of the package. And those would be things like solutions, inhalers, and insulin. Insulin might come in 3 packs of pens and so forth. Make an estimate. First of all, record what the package size is, and then make your best estimate of how frequently you purchase that. And you'll see in the plan finder, it can accommodate 1 a month, 2 or 3 a quarter, so many per year. So give it your best estimate of how frequently you repurchase some of those types of drugs, if in fact you take them. So let's begin. To set up a Medicare.gov account, if you don't have one yet, you need your Medicare card. You're looking for your account number and what date you begins Part A and B. The rest of the information you should know. It's going to be things like your date of birth, your address, and you will set up an account with a username and password, and you agree to the terms and conditions of the website. So let's begin. We've now assembled our list of drugs, and we're going to sign into Medicare.gov. Okay, let's try this again. Huh. Oh. Give me just a second for some reason. Come on. Okay, here we go. Sorry for the delay. Okay. So I'm going to do 2 things. The first way I'm going to do it is I'm not going to log in. I'm going to show what it's like to come in from the outside and run a very, very simple drug plan. So if I come in and I scroll down, I'm going to do Find Health and Drug Plans. I'm going to click on it. It advises me that I'm better off to set up a Medicare.gov account, but for the moment, we're just going to stay in from the outside. This could largely be for people that haven't yet received their Medicare card yet, but want to do a little homework. So we're going to go We're going to enter the zip code for our town, and we're going to continue. Now I'm going to come up and I'm going to choose a drug plan, Part D, and I'm going to proceed. If you get any of these assistance from some of these programs because you're lower income, you can choose it here, but I'm going to say that no, I don't get any assistance from these programs. And then we'll proceed. Do I want to see the cost? Yes. And we'll proceed. So here we go. I'm only going to put 2 drugs in just to keep it very simple. And I'm specifically choosing a couple to show you some of the features you may see. I'm going to put in atorvastatin, which is generic Lipitor. Many people are on cholesterol drugs, and this is a very common one. So I'm going to type in ATOR, and it automatically is going to give me a list of drugs that have spelling like this, and there's my atorvastatin. I'm going to add the drug. It comes up, it's going to default with all the fields filled. So I'm going to come up and I'm going to change the dosage. Let's say we're on a 20 mg tablet. It defaults to 30 every month. This is a field where I can clean it out and I can put in a different number. And then with this field, I can choose the period. So going back to my example, if you take something like a package of insulin and you buy, let's say, 2 or 2 a quarter or 7 in a 12-month period, this gives you the opportunity to put in any quantity, but I'm going to keep this simple. I'm going to say that we take 1 pill a day, and I'm going to go with the default. So it's in. Now I'm going to add another drug. The drug I'm going to add is Synthroid. I start to type it in, and Synthroid comes up. Now, I specifically put in Synthroid. I've done plans for people. It's I'm trying to think of the name of the, it's for the, I can't think of, it's for the thalamus or something like that. Anyways, it says, do you want to add the generic? So I've got a choice here to go with the generic, but no, I'm going to say on my list, the person told me that they wanted Synthroid, so I'll proceed through this warning and keep the brand. I'll say this is in fact the dosage. They take 1 a month, 1 every day, so it's 30 a month, and I'm going to add it. Now with this in, I'm going to say I've completed the drug list, so I'm going to say that I'm done. Now we need to add pharmacies, and I'm going to add pharmacies that are nearby. First of all, I'm going to put in a mail order. It's never a bad thing to put in mail order. I'm going to choose CVS. I'm going to choose Walgreens. And I'm actually going to go down and choose Osco. For those of you in town that may not recognize it, Osco is in Shaw's around us, and that one is in Medfield. The reason that I'm doing a list of pharmacies, I may prefer to go to 1, but I want to see what's preferred in network and what's not, because it may affect my decision of which I'm going to go with. So it's going to bring up the lowest cost plan first. Okay, first of all, we're filming this on the 19th of September. So the only thing we're looking at is for the rest of the calendar year 2023. So when you see some of the costs are going to appear low, but all we're looking at would be October, November, December, all costs aggregated. So the first one we see on the list is SilverScripts. It's $680 a month, and it's going to give me the estimated cost of the $680 times 3 plus whatever medications I put in. And what I'm going to do is I'm going to click down here to add and compare. I'm going to go down further, and I'm going to, normally I would pick the next closest one, but I've got an objective here, so I'm going to go down to Mutual of Omaha, and it'll become clear why I'm choosing it when we do the comparison. So I'm going to add and compare, and I say, okay, I'm done. So I come down to the bottom of the screen, and I click on compare. So it's going to bring up the two that I chose to compare side by side. We've got a $680 per month and a $20.40 per month premium. We go down, and this is one of the reasons why I brought up Mutual of Omaha. In my first case with SilverScripts, both drugs were covered, 2 of 2. If I go under Mutual of Omaha, only one of the two is covered. If I go down further, I see who is in and out of network and who is preferred. Under SilverScripts, CVS and Costco are preferred pharmacies. Walgreens is out of pocket, and you notice the all-in cost for Walgreens is considerably higher. If I go over to Mutual of Omaha, all 3 of those pharmacies, no, I take it back. One was preferred, CVS. Costco and Walgreens are in network, so they'd be a little bit higher. So now from here, we're going to go in and look at the plan details. I'm going to look at SilverScripts. This is where a lot of people that I send plans to glaze over, because it's a very comprehensive report, and most people are lost. So we'll try to straighten a few of those things out for you. We go down, we already know what the premium is. This one has a $505 deductible. If you remember it, it told us that on the first page as well. We get another listing of what's in network or out of network in terms of pharmacies. Now we start to see the costs. Again, as I mentioned before, this yearly cost really only represents the 4th quarter because we're in September. Everything on Medicare is full month. So even though we're in September, it's just giving us what the costs will be for October, November, and December. When you go in during the open enrollment period, and I'll show you where to look, you can choose next year, but it's not up at this time. It'll be up in about another month. So you see what the costs are. And by the way, when we saw the Walgreens was very expensive, it's because it's out of network and they're really charging you heavily for atorvastatin. You would not choose this plan if these 2 drugs were what you took, or you'd go to a different pharmacy like CVS. It's giving us information down here. We won't meet our deductible for the year, but again, we're only looking at the last quarter. It'll tell us what our expected monthly payment will be, assuming we had to order both of those drugs. And this is really what I wanted to show you. A lot of people will miss this. I get down to a blue bar, view more drug coverage. And this has opened something up, and I'm just going to go right down and show what I wanted to show you. A lot of people are asking, well, how would I know what tier my drugs are in? Well, the plan will tell you. So the statin is in tier 1, the Synthroid is in tier 4. So you don't have to know before you go in and run the plans what tier they're in, but each plan will tell you, and they're not necessarily in the same tier from one insurance company to another, But if you go in and look at the lowest cost plans first, chances are you're going to find your drugs in lower tiers in that particular plan. So with that, I'm going to come out, and I really only want to show you one thing. I'm going to go back. Here's what I'm choosing. Go back to plan comparison. And I'm going to go into the plan details of Omaha, of Nebraska. And I'm going to really go right to the bottom. It's the thing that I wanted to show you. In this plan, we're going to view more drug coverage. We're going to go down. And here we are. The atorvastatin is covered. The Synthroid is not in their plan. It will give you a price for it, but they don't cover it. They cover other medications for this disease state. Any questions? Okay, so with no questions, I'm now going to log in, and I'm going to show you how you would set up your Medicare account. If you see me, I'm up in the top right corner, and it says login. As I say to you, there's always more than one pathway to get to where you want to get to, but this is the first thing I would do. Go into Medicare.gov and log in. If you do not have an account, this is your opportunity to create an account here. I'm not going to create an account because I already have one, but I think I can take a peek at it. You're going to start to answer questions, and I showed you on one of the slides. You're going to need your Medicare number, in what month you went on either Part A or Part B, and then from that point on, you should know everything. It would be your date of birth, your address, etc. It's trying to identify who you are. You put in a password, a username, and the benefit is with an account, every time you come back in, whatever you've done, your list of medications, the pharmaceutical companies you chose, not the pharmaceutical, the pharmacies that you chose will all be saved. And from that point, you either confirm or you edit. I am going to go back. And my computer remembers who I am, the username and password. I'm going to log in. So I happen to be on Tufts Medicare Preferred. I'm not advocating it. It's going to say who you are and what you are. If you noticed, if you remember in a few slides ago, I chose that I don't get any help with Medicare drugs, with cost of drugs. Your profile is saved. Even you looking at it, you know that you're still actively in that program. And I told you it would remember what I put in. And lo and behold, when I went and looked, I have mail order and 3 pharmacies near us. If I were to go in and do my plan now, I would just go in, I'll click on Find Plans now. Oh, okay, yes. I'm going to confirm my zip code. I'm going to do Part D. I'll do Part D drug plans. I'm not going to go too far with this. I'm going to say Find Plans now. At this point, if it was a month from now, a radio box is going to open up and it's going to say, do you want a 2023 drug plan or 2024? It will default to 2023, so choose 2024 and everything you see will be aggregating all the costs for the full calendar year, and that's how you should proceed forward to taking a look at what would be a good drug plan for you in calendar 2024. And you've got between October 15th and December 7th to do that. I think I just want to show 1 or 2 more things. Here's the first plan. I'm not going to go anything too far with this. But you see here, when I'm in this plan, when I'm looking at any plan, it gives me opportunity to enroll directly. And I would encourage you to do that. If you have your own Medicare account, you like what you see, you can simply enroll by clicking the enroll button and it'll take you through a few screens. If you've got a Medicare account, it knows who you are, so it will be providing your Medicare number, your name and address, etc., to the company that you're going to enroll with. And maybe you'll answer a couple of questions like, do you want to be automatically billed, or do you want the premium sent to you and pay it? It's a relatively simple things, but you can enroll and be done with it. Any questions? So with that, given the low attendance today, I think I will wrap it up here. And if you have any questions, by all means, get a hold of me through the Senior Center, and Rochelle or somebody else here will get a hold of me, and I'd be glad to help you. Thank you very much.